I am Dr. Tarun Praharaj, Senior Consultant Cardiologist at Birla Heart Research Center. I'll be talking on something very interesting because as you all know, lipid profile or cholesterol is one of the major risk factor of premature heart attack. It is very important for all of us to know exactly what is cholesterol. Cholesterol can be like good cholesterol or bad cholesterol, but everybody should have a regular lipid profile check from the age of 30-35. Since the incidence of premature heart attack has gone up in our country, and a lot of young people are getting heart attack prematurely before age of 40, we have found that lipid profiles are grossly abnormal. There are many other incidences where you have strong family history of premature heart attack, when the lipid profile should be checked from young age, from the age of 20-25. But if someone doesn't have a family history of premature heart attack, still he has to get a lipid profile check from age of 30-35 because of the incidence. Now cholesterol, we call it lipid profiles. Then you have cholesterol, triglyceride, HDL and LDL. HDL, high density lipoprotein, is known as good cholesterol. LDL, low density lipoprotein, is a bad cholesterol. So if your good cholesterol is in the higher margin, more than say 60, then your chance of getting premature heart disease will be less. And if the LDL is high, that is bad cholesterol, low density lipoprotein. If LDL is high, that is known as bad cholesterol, your chance of heart attack will be much higher. This is a preventable disease, and these are very important figure. Everybody should know their lipid profile level. What is the cholesterol level? What is your HDL level? What is your LDL level? Everybody should know it, especially for those who are above 30-35. And it should be checked every yearly, at least every yearly or maybe every 2 years from young age. And studies have shown, if your cholesterol is high, if your LDL is high, for example, someone having cholesterol of more than 250 mg/%, LDL is more than 120, his chance of getting premature heart attack is much higher as compared to someone who has a cholesterol of say 150 mg/% and the LDL is less than 70. So naturally these numbers are very important. So when you go for lipid profile examination, you should have entire thing at a time and then try to manage himself by changing lifestyle. For example, someone is very fond of eating outside food, junk food. So naturally that is exogenous source of cholesterol, and if you take a lot of saturated fat or if you take outside food, junk food, then your lipid profile will be grossly abnormal. That is happening to our youngster nowadays because it's easily available and the taste is also very good. The boys and girls, young age group, I have seen many of them, they are very fond of food from outside, and that is one of the major cause of premature heart disease. Besides cholesterol, there are other risk factors which I don't think it is important for us to know, but yes, smoking habit, lack of exercise and stressful lifestyle definitely plays a very important role. But lipid profile is also equally important, because if you have a regular lipid profile checkup from age of 30-35, you can always prevent major cardiac event at young age. Now besides dietary advice means have more of unsaturated fat, have plenty of vegetables, fruits, salads, and have regular exercise, and this is how we can bring down your lipid profile, the cholesterol level to some extent. I have seen people, those who have to perform regular exercise, their lipid profile from say 250 mg has come down to 200. LDL, which is maybe 120 before exercise, has come down to 100 and below 100. So exercise plays a very important role. That includes not only walking but also yoga and regular meditation. Everything in combination works very well for controlling your lipid profile, because this is one of the major risk factor and it's a preventable risk factor. So once it is very important, we should have our lipid profile checked from very young age, say from the age of 30-35, and keep it within normal range so that we don't have premature heart attack.